I don't know who needs to hear this, but healthy gums do not bleed. Let me prove it to you. Get real up close and personal. I want you to see. Look at that. See that? You look at this tiny little instrument, it's called a perioprobe. You see all of those lines, those are actually millimeter markers that we use to measure the depth of your gum pocket. So if you're ever at the dentist or hygienist and they start calling out random numbers like 232, 544, really shouldn't be hearing 4s and 5s, but what those numbers are essentially just measurements on this little instrument. And by the way, this is a blunt instrument, it is not a sharp instrument. When patients say either 1, I'm bleeding because you poked me, and 2, you're poking me with a sharp instrument, this is a blunt instrument. This is what we actually use to measure your gum pocket. The Explorer is a sharp instrument. This is what we use to check your teeth for cavities usually. The difference is that this, if you scrape it, it will cut you. Whereas this, if you go on your hand, it won't cut you because the end is blunt. So what we use this for is to measure how deep your gum pockets are, because that tells us how healthy your gums are, whether there's bacteria and inflammation present, and whether you have gum disease or not.